We've been talking a lot about coronavirus, known as COVID-19. It's been dominating the news coverage lately, and with the coverage, of course, come many questions. Here to help us as we go through some of the more common questions, our 9Health medical expert, Dr. Payal Kohli, back with us today. You're a regular visitor.
I am.
That's not necessarily good news.
No.
It means we're talking about health issues. Let's talk about the term pandemic, because I think many people are familiar with epidemic. A pandemic is different how?
So a pandemic has to meet three criteria. The first is it has to be a new virus that people are not used to seeing, their immune systems don't recognize it, and therefore it kills. So COVID-19 meets the criteria for that. The second is there has to be worldwide geographical spread. Again, COVID-19 meets the criteria for that because it's all the continents except Antarctica. The third, which is the reason they haven't called it a pandemic yet, is that there has to be evidence of sustained and easy transmission from person to person in a community.
Okay.
So the WHO and CDC are saying we're inching closer to that, but so far they don't feel we've demonstrated enough of those community spread cases for this to qualify as a pandemic.
If we do get there, pandemic then is worse than epidemic.
Absolutely. Pandemic is worse. It also has implications for how we handle things because it activates a lot of protocols at regional, state, and national levels that have to be implemented, health protocols and such. Talking
about health protocols, we talk a lot about testing. What are those signals that someone might have, the coronavirus, COVID-19? Are people being tested? How are the tests working at this point now that we're a few weeks into this?
Yeah, so the tests have been rolled out at the state level, and the CDC has issued some very specific criteria to physicians as to what to test. And it's a combination of two things. One is your signs and symptoms, and the second is your exposure history. So if your signs and symptoms are more typical, and you may have had a second-degree exposure, meaning you got exposed to somebody who was exposed to somebody.
It's been overseas in Italy,
right.
Iran, or China.
Right,
like
exactly.
That.
Then you can get tested. The only time you can get tested without symptoms as it stands right now is if you're critically ill, you're on a ventilator, you're in the ICU, and there's no other good explanation. But just last week, the CDC actually relaxed those testing guidelines because we missed a case in California where the woman had presented, but she didn't meet those strict criteria.
Not many people have been tested here in Colorado.
Unfortunately, no, and to me, that's a bit of a surprise, to be honest, because I thought that we got 160 the ability to do 160 tests every day, we would be using that to full capacity. And we're actually only using 4% of those tests. And so, in my opinion, if we're looking harder, we're more likely to find the milder cases and we're more likely to understand how to control it. But Dr. Fauci, who's the director of the National Institute of Infectious Disease, issued a statement just recently actually saying that they're going to do something called proactive testing in 6 cities. Now, Denver is not one of them, but what the proactive testing means is to start testing people who are having very mild or very atypical symptoms, even if it's just a runny nose and a headache.
Just to get them tested.
Just to get a sense exactly what it's doing.
We'll see if there is more testing done in Colorado. We'll probably talk to you again tomorrow.
All right.
Seems like we're talking a lot. Thanks, Payal, as
Thank
always.
you.
So, not many people are being tested yet.
No, but we need to know this stuff. I mean, it is really, there's a lot of misinformation out there.
It's so true, and I feel like proactive testing would make me feel a little bit more
comfortable.
comfortable.
Would make me feel a little better,
People
too.
are coughing around me now. I'm like, hold up. All right, guys, thank you.